angina, coronary artery disease, type 2 diabetes, all hypertension, atrial fibrillation, congestive heart failure, drug-resistant hypertension. Firstly, rule out OSA. Rule out any sleep apnea related disorders in all these drug-resistant hypertension, drug-resistant resistant uncontrolled diabetes, all hypertensive cases, AF, all CHF cases, coronary, all coronary artery disease, angina cases. Rule out sleep apnea. OSA and cardiovascular. Hypertension is the most common cardiovascular disorder on OSA. Important feature of hypertension in OSA is absence of the nocturnal fall in BP and heart rate. Atrial fibrillation is the most common tachyarrhythmia in OSA. It is also ventricular ectopics can be seen, non-sustained ventricular tachycardia, sinus arrest, and AV blocks also seen. Prevalence of OSA is twofold higher than those without coronary artery disease, and incidence of heart failure increases with increasing severity of OSA. And neurocognitive effects. Cycle of repeated obstruction and arousals lead to disturbed sleep architecture and cognitive decline. There will be decline in the reasoning, comprehension, and learning, and impaired fine motor coordination. Risk of stroke increases by 6% with every unit increase in apnea-hypopnea index. OSA and diabetes. Disruption in the sleep-wake cycle is associated with disruption of corticotropic, thyrotropic, and somatotropic pathways and is associated with glucose intolerance. Increasing severity of oxygen desaturation and intermittent nocturnal hypoxia is associated with increased risk of developing type 2 diabetes. Prevalence will be 15 to 30%. Prevalence of diabetes in OSA is 15 to 30%, and the vice versa is around 70%, which is very high. OSA adversely affects the glycemic control, which is directly related to the severity of OSA. This conclusion shows that CPAP improves not only hypoxia while restoring normal breathing during sleep, but also glucose metabolism in patients with OSA and diabetes. Polysomnography sleep study. These will be assessed: brain activity with the help of EEG, eye movement, airflow through the nose and mouth, chin muscle tone, EMG, cardiac activity with the help of ECG, thoracic muscle effort during breathing, abdominal muscle effort during breathing, and level of oxygen in the blood with the help of pulse oximeter, leg movement with the help of EMG. These are the levels of sleep tests: level 1, level 2, level 3, 4. Usually there will be level 2 in most of the hospitals. Level 1 will be including a minimum of 7, including EEG, EOG, chin EMG, airflow, respiratory effort, oxygen saturations, and ECG. This is attended by sleep technician. Level 2 is exactly like level 1, but it is unattended or unattended by sleep technician. Level 3 will be minimum of 4 channels: ECG, O2 saturation, 2 channels of respiratory effort or 1 respiratory channel and 1 airflow channel. It is either attended or unattended by a technician. Level 4 will be minimum of 3 channels, of which airflow, oxygen saturation, peripheral arterial tone. It is either attended or unattended by sleep technician. These are obstructive, mixed, and central. Obstructive events are characterized by continued thoracoabdominal effort in the setting of partial or complete airflow cessation. Central events will be, there will be lack of thoracoabdominal effort. Here you see in central there will be airflow is not there and respiratory effort is also not there. Mixed events have both obstructive and central features. They generally begin without thoracoabdominal effort and end with several thoracoabdominal efforts in breathing. There will be central apnea is cessation of airflow for at least 10 seconds with no respiratory effort. So this is central apnea. Whereas airflow is not there. At the same time, thoracic and abdominal respiratory efforts are also not there. Mixed apnea. Treatment of OSA, firstly behavioral modifications like lifestyle changes, daily exercise, keeping the BMI in control, having good control on food, exercise, etc. Non-surgical modalities, which I'll detail later. Surgical modalities. Behavioral modalities like weight reduction, avoiding CNS depressants, sleeping sideways in lateral position, stop smoking and drinking, and using external nasal dilators. Weight reduction, exercise, diet, in extreme cases, bariatric surgery, which is highly effective method. But this bariatric surgery is only for extremely overweight people only. 10 to 15% weight reduction can reduce sleep apnea severity by 50% in moderately obese male patients. These are non-surgical modalities. So most of the sleep apnea cases we use CPAP. Firstly, we advocate lifestyle modifications, exercise, diet, etc. And later we prefer CPAP. It acts as a pneumatic splint. It maintains patency of pharyngeal airways. Autopap. This autopap continuously self-adjusts the pressures to treat OSA based on analysis by an internal microprocessor of flow amplitude reduction, inspiratory flow limitation, and snoring. CPAP. So in this picture you can see there will be zero. Normally there will be zero. If it is 0 centimeters of H2O, the caliber will be like this. If it is 5 centimeters, caliber like this. 15 centimeters, there is maximum increase in the caliber. CPAP titrate pressure that can overcome the airway obstruction. Settings will be usually from 5 to 15 centimeters of H2O. It can be delivered with nasal or face mask. It is effective in more than 90% of the patients. There is a decrease in BP and daytime sleepiness. So the problems faced with CPAP are mask discomfort, acceptance, and claustrophobia. Initially, there will be aerophagia, but as time progresses, patients get accommodated to CPAP. So these are various interfaces. This first one is nasal pillows. This is also nasal mask. This is oronasal mask. Oral devices. The tongue retaining devices, mandibular advancing devices, soft palate lifter. So these are the tongue retaining devices. It keeps the tongue in forward position by creating negative pressure in plastic bulb and fit between lips. Mandibular advancing devices, they cause forward or downward movement of mandible. Soft palate lifter, it is effective only for treatment of snoring. Underlying disease may not be corrected. Surgical modalities. Reconstruction of the upper airway by using uvulopaltopharyngoplasty, laser assisted uvulopaltopharyngoplasty, genoglossal advancement, nasal reconstruction, adenotonsillectomy if they are enlarged, but prefer treatment in children, partial glossectomy if it is large like an acromegaly, hypothyroidism, etc. And the problem is severe. If the upper airway is to be bypassed, you can use tracheostomy. Obesity hypoventilation syndrome or Pickwickian syndrome. It is defined by morbid obesity, BMI more than 40, and chronic hypoventilation with hypercapnia, partial pressure of CO2 more than 45 mm of Hg during wakefulness. Characteristic findings observed are awake resting hypoxemia, hypersomnolence, and signs of carpal tunnel like right heart failure, lower extremity edema, and nocturnal hypoventilation. Diagnosis of obesity hypoventilation syndrome requires a demonstration of at least 10 mmHg increment in partial pressure of CO2 during sleep. Management. Firstly, weight loss, which improves the pulmonary function, central ventilatory drive, and concomitant OSA. However, it should not be used as the only strategy. So in case you can go for nocturnal NIV. The treatment of choice has been demonstrated to correct the daytime and nighttime hypoxemia and hypercapnia, and it ameliorates the sleep fragmentation, allows for respiratory muscle rest, reduce pulmonary artery pressures, and improve right ventricular function. Take home message will be, Firstly, sleep is an important entity in day-to-day life for good health and optimum cognitive function. It is a common entity in population which is left unnoticed. Sleep disorders, it may cause accidents, so it is detrimental to both the patient and the society. Increased disease burden during later stages of life. So whenever any person is snoring, so ask the patient to get the sleep study done. Thank you. Thank you so much for patient listening for this OSA. Thanks.